Good evening, everyone. Thank you all so much for coming out tonight, and thank you so much for your patience. You all are at the We Birthed This live storytelling showcase. Are you all in the right place? Okay, all right, perfect. So I am Regina Hall, and I serve as the Executive Director of Boston Thurman United. I also moonlight another job, which is being the council member of the Northwest Ward for the City of Winston-Salem City Council. Thank you. And so tonight, I am here with my official Boston Thurman United hat on, but also with the Forsyth County Birth Stories hat. So Forsyth County Birth Stories is a project that was birthed out of a call to action from the Kate B. Reynolds Charitable Trust. And tonight we do have Chanel Thompson that is here representing the trust, and also Veronica Smith. We have a Veronica Edge that's coming into our family. But Veronica Smith that are also here from the trust, so thank you all for being here. That call to action was to address the high rate of infant mortality, unfortunately, that has plagued our community for several years. For those that may not know, the 27105 zip code has had the highest rate of infant mortality for well over 20-some years. Now, it does go back and forth with the 27101 zip code, but both of those zip codes are in the urban core of Forsyth County. And so the trust said, hey, we need to do something about trying to address equitable birth outcomes, particularly in this zip code. And so this work was birthed out of a call to action. We are the community-based organization that responded to that call. And we have been blessed with the opportunity to meet with moms over the past three and a half years in gathering stories, powerful stories from these moms who have been so brave to share their stories, and you all will hear just a glimpse of what we've heard over the past 3 years tonight. I would like to introduce the team, and so in addition to being on the screen behind me, they're also scattered throughout the room tonight. And so Mary Ford is the Vice President of the Neighborhood Association for Boston Thurman. There's Mary. And we also have Keisha Money, who serves as the project manager for the Forsyth County Birth Stories team and works for Boston Thurman United. We have Alexia Mitchell, and she is the founder of, and she's a licensed clinical therapist, the founder and owner of Reset and Heal, PLLC. And we also have Candace Dixon, who is also a licensed clinical therapist. She is in the back. And she is the owner of Breaking Cycles Counseling, PLLC. We also are blessed to work with some amazing partners, population health improvement partners. They are also here tonight. Sarah Massey is the co-director, and she is here, executive director. And I think that Beth is here too. She's the other co-executive director, which right there Beth is right there. And we have Sherry Leonard. Sherry serves as the program manager for Population Health Improvement Partner. Sherry is right in the front. Mary Webster is an improvement advisor, and she is not here tonight, but we do want to recognize her. And then we have Megan, who's our program coordinator, and I think Megan may still be outside. She's still working, but we do want to give it up for Megan. And we also work with Pastor Timbila Covington. So sometimes we have, I guess you can never take off the pastor hat, but she needs it a lot of times with us, I'm sure. But we're happy to have Pastor Timbila Covington on our team. We also work for Neighbors for Better Neighborhoods. And so you all are in for a treat tonight. This evening does start with a panel discussion, and it will be facilitated by Sharday Hassan, which will be coming up shortly. At this point in time, I do want to do a little bit of housekeeping before we move forward. We do have restrooms that are to my left, your right, male and female restrooms. We also still have some mint water and lemonade in the back. If you all get parched and need to be able to have something to drink, feel free to do that throughout. Also, if you would please silence your cell phones at this point in time or put them on vibrate. Again, silence them or put them on vibrate. We would appreciate that. As you are doing that, I'm going to call our panelists to the stage. If you did not get a rack card when you came in, please raise your hand and someone from the team will make sure you have it. It does have a QR code on the back. Okay, I see you. My mom is raising her hand. My mom and my grandmother are here. And so on the back of your on the back of your rack card, there is a QR code. We'd love for you to scan that. That QR code allows you to connect with us. It does have about 6 different links to a link tree that allows you to go to our website, Boston Thurman United website that leads this work, in addition to finding out who our vendors are tonight. We have video production team, we have photography, we have sound, and of course we have Epic Tribe that will be bringing forth the performance tonight. We're so blessed to have them. So please join me in a round of applause for them, for all being here tonight. And again, that QR code will take you to a bit of information of how you can help us go further, faster. And so I will call at this point in time Alexia Mitchell, Keisha Money, Mary Ford, and Miss Lauren Gibbs from Novant Health to the stage. And I will pass my mic to Sade. Thank you all so much.
Good evening. Oh, that was a little bit sad. Good evening. Hi, welcome. Thank you for joining us. Once again, my name is Sade Hassan. I am one of the co-founders of Epic Tribe. Epic Tribe is a theater production company, and we have been working closely with Regina, the Boston Thurman United team, as well as Forsyth County Birth Stories to help put together an amazing storytelling showcase for you here today. But we're gonna start out with a few questions. So I have some ladies to my left and to my right. Regina has said a little bit about you all, but I'm gonna run your resume just a little bit because, you know, when you work hard, you deserve to have your flowers. So to my farthest right is Alexia Mitchell. We already know that she's the owner and co-founder of Reset and Heal, but she is also the founder of the Black Mental Health Summit, which is an annual event that is held here in Winston-Salem. She holds her Bachelor's of Arts degree from Winston-Salem State University, and she has her graduate degrees from UNC Greensboro and North Carolina A&T, where she has a master's degree in social work. So clap it up. That's a lot of, she put in her time. To my immediate right is Keisha Money, and I'm sure I'm not the first person to call you Keish Money. I didn't think so. It's very unoriginal, but Keish is the executive assistant at Boston Thurman United, and she plays a very big role in the Forsyth County Birth Stories project. She has been one of our main points of contact. She has been our go-to. She has been the person who showed me how to get in this building today. So we appreciate you for that, Keisha. And also, you're a Winston-Salem native, and that is important to the conversation that we're having today. So give Keisha a round of applause. To my left, we have Miss Mary Ford, who has been a resident of the Boston Thurman community for well over 12 years. She's the secretary for Neal's Place Neighborhood Association and the vice president for the Boston Thurman Neighborhood Association. She works in healthcare, but her passion is in public policy and human services. She is also a graduate of Winston-Salem State University, where she holds her bachelor's in political science. Give it up for Miss Mary Ford. And last but certainly not least, to my far left is Lauren Gibbs. She is the clinic administrator for Novant Health, today's women OBGYN, today's pediatrics, and today's adult primary care. Those organizations have been a part of the Boston Thurman United community for over 20 years, since 1995. And she has been working in her capacity for over 20 years as well. She has her training as a registered nurse, but contributes a lot in many different ways to the public health that those organizations work on. So please give it up for Lauren Gibbs. All right, so Keisha has a mic. I don't know why we decided to sit like this, but we did. So here's what we're gonna do. I'm going to be the go-between and pass the mic. And as I ask the questions, I'm going to offer for everyone to just, from your own perspective, give your insight, and we'll make sure the mic gets to you. How about that? All right, so first of all, we are here today. We are in Winston-Salem. We are in the Boston Thurman neighborhood. What was that, Miss Mary?
My house.
Oh, this is her house?
Welcome.
She said welcome.
I just want to welcome y'all to the beautiful Boston Thurman neighborhood.
As she should. Welcome to her kingdom, Miss Mary said. We're talking about stories of maternal health and experiences that we have as Black women in the process, in the healthcare portion of that. And I want to know from each one of you why this work matters to you. What about it is important for you? And Keish Money, you got the mic first, so you can go ahead and go first.
So this work matters to me. Well, first off, hey everybody. I know she said it, I know Regina said it, but I am Keisha Money. I am the project manager for Forsyth County Birth Stories. But this work is so important to me because I get to touch so many lives. I've met so many women. It's just remarkable in how I was able to come into this work, learn so much, and then I'm also being taught different things. So I don't take it for granted at all.
We love somebody who's touching lives and hearts. Thank you so much, Keisha. How about you, Alexia?
So for me, this work is important because I'm a mother of 3, and I have a teenage daughter who one day, she aspired to be a mom herself. And when you look at the statistics of maternal health amongst Black women, I want her to feel safe. I want her to be safe. And I want the rest of my family and community of Black women to feel heard, to feel seen when they give birth. And oftentimes, per the statistics, we are not heard, seen, or even felt like we experienced pain. So today, and the work that I've done to contribute to Black maternal health, that is my why for why I do this work. It's just to make sure that no other woman feels unseen, unheard when she's in the room giving birth to her baby.
Thank you so much, Alexia. I'll pass it over to you, Miss Mary.
Thank you. This work is important to me because doing this work, we realize that this work has the potential to save lives. This work has the potential to help stop the death of Black and brown moms. And also, like Alexia, I also have a daughter. And one day, I would like for her to go through her birthing experience without the fear of losing her life or her unborn baby's life.
Thank you so much, Mary.
Thank you, Mary. I think personally for me, I have a background in family practice nursing and was also fortunate to work in a position where I looked at population health and then later had an advising job in patient experience. And kind of all of those positions gave me an ability to look at the data, which we've talked about, the disparities and the inequities that exist, the outcomes that are not, favorable for minorities. And in patient experience, I was able to kind of get in there and hear directly from the patients what they need from us that we're not providing, where the gaps are, where we drop the ball, where we drop the patient, along the journey. And then when I came to volunteer at Today's Family, Today's Woman, Today's Peds at that time, during COVID, I just sort of fell in love with the clinic and its mission and the people that worked there and the heart that was just kind of just there for caring for the community that I really had not experienced working in a clinic where community was the focus and knowing your patients and greeting them when they come in like a friend. And it really inspired me, brought me back to why I wanted to be a nurse. And kind of brought all of that statistical knowledge and that population health knowledge, and then this real life example of people that really want to raise their families well and are met with so many barriers in the system. And I wanted to be part of a little tiny part of the change to the system so that we're not setting up barriers and we're not making it more complex than it needs to be, so that people can be heard.
Thank you so much. We have so many different perspectives, and I am so excited to hear you all's answers today. We're really covering the gamut, and it is important. We've learned a lot from the stories that we've heard. Even through Epic Tribe's role in this process, we interviewed and we listened to the stories, and you'll hear some of those today, but there's a lot to be learned just from listening to the people in the community. So speaking of the community, Ms. Mary said we're in her house. We're in the Boston Thurman neighborhood. And I want to know, tell me, starting with you, Lauren, since you have the mic, why is it important that we are telling stories from Boston Thurman neighborhood? What is it that we can learn by speaking directly to the people who are part of this neighborhood, who are part of this community?
It's tricky waters for me to speak on a neighborhood that I wasn't raised in and a neighborhood that I don't, have back history with. But I will tell you that there's a major sort of resilience and interconnectedness in this neighborhood that I've experienced in the last 3.5 years that I've not experienced in 20 plus years of nursing, and certainly in my lifetime, that really is inspiring. There's a great history in the Boston Thurman, neighborhood that goes back over 100 years, 130 years, which Mary and others can speak to certainly better than I can. But that sort of resilient, we will persevere sort of attitude and the sense of community that's strong here is a really great starting point for us to enact some really important change. It's a good hub for us to start in, because there's a lot of strength and faithfulness and beauty right here in this neighborhood.
I want to ask you a little follow-up question.
Great.
You were talking earlier about data, and stories are a type of data, but a lot of times stories, firsthand accounts, feedback are not taken into consideration as much as numbers.
Right.
So being from outside of the community, but also being someone who is on the receiving end, you hear these stories, you're immersed in the community to some degree. How can you connect that back to the data that you need to make changes?
Yeah, that's a great question. So the healthcare industry, as you know, is very data-driven. Novant Health is no exception. As you know, there's purple all over town, right? So we're data-driven, successful healthcare organization. But our main cause, and the actual cause statement that we live by, is about community, is about affecting change individually to then affect larger communities, to then affect global healthcare in the United States. And there is a definite kind of thread that connects the three. But if you're going to look at data, you have to get down to the person that's attached to it. And rather than look at the symptom, which is the data, right? You have to get up under that and look at where the real problem is. Where are the misconceptions? Where are we missing a listening ear? Where are we making assumptions? Where are the microaggressions? Where are the all of that stuff, and kind of get up under the generational kind of wives' tales that people are living with from very real places in history where the healthcare system has not only disappointed but taken advantage of Black and brown communities. That's all coming from a really real place of fear and mistrust. And so in order to get under that and solve the ultimate problem, which is the health outcomes, you have to get to know the individual people and serve them, and emphasis on the word serve. Serve them when they come to you for help. And I think Novant Health is trying, as a large organization, to focus on community. And I know the message they've sent me over my 20 years with them is see the person, hear the story, and then the healthcare comes as a result of that.
Thank you so much. The story is our starting point. Miss Mary.
Yes.
Tell us about how you are part of Boston Thurman neighborhood, and why what is your perspective about why it's important that we are talking specifically to mothers in this neighborhood?
Yes, so So my connection to the community is I'm a resident. This is my home. This is the place where I brought my 5-year-old daughter to live and govern our lives. This is the place where we lay our head every night. This is community. I don't know what led me to this community, but I wouldn't want to be in any other community. We have a good, solid neighborhood association. Our neighbors are like family. And thanks to agencies like Novant Health, which is also our neighbor, today, what are formerly known Today's Woman, they are willing to give us access to good health, access to good health. This work started in Boston Thurman, but as we do this work and talk to other people across the 27105 zip code, it doesn't have to stay here. This work is spreading across Forsyth County, and a lot of people are interested, and a lot of people from other communities came and joined Forsyth County Birth Stories, and I think it's wonderful. I think it's dope what KBR has given us the opportunity to do. It's just a cool program to be a part of, and I'm glad that I was able to be a part of it.
So you're starting something here.
We started something. Mm-hmm. Yep, we have.
All right, thank you, Ms. Mary.
You're welcome.
All right, Keisha, tell us why specifically Boston Thurman community stories?
Well, aside from us having the highest infant mother mortality rate, sometimes I feel like these stories get lost in the shuffle. Mm-hmm. You hear about everybody else's story and everybody else's journey, but nobody takes a second to sit down and listen to the stories that we have here. Mm-hmm. So I think that's one of the main reasons why we, Boston Thurman is the highlight. Mm-hmm. Because their stories need to be heard just like other stories need to be heard. So that's one of the reasons why.
Level the playing field?
Right.
Make sure that they get the mic like everybody else gets the mic.
Exactly.
Pass it to Alexia for me.
Yeah, so I think for me, oftentimes we look at data, we're all data-driven, data, but we don't take the time to say what happened or why, So my goal of why I'm part of this project is, I see the data, but why? There's a why behind it. And with the storytelling, it helped us to understand the why. Mm-hmm. Oh, I know why, because we Black. I'm just going to be honest with you, and even in textbooks, it is still shown in nursing books that Black women don't feel pain. Mm-hmm. So that drove me. The data brought this project to this area, but for me, it was deeper than that. It was why, what happened? And then also, I want to support these women while they're telling their stories. I don't want them just to open themselves up and then we shut them off. Mm-hmm. Because now we're recreating something else. We're perpetuating the trauma that that was caused by you all collecting your data. Yeah. So for me, it is deeper than that. It's deeper than, is Boston Thurman? No, I look at it, a lot of my sisters live in that area. Mm-hmm. Those sisters look like me. Those sisters look like my daughter. With this project, we've seen young ladies as young as 16, 17 in there with their mothers, sharing their story. So for me, the data is what led me here, but it also intensified the work for me. And it just so happened that Boston Thurman, this zip code, has the highest rates, such as Keisha said. So it could have been 27106. I'm still there because that's my advocacy. So yes, I'm here for this project, but it's bigger than me. So
you brought up sisterhood.
Oh, yeah.
And it's a perfect segue into the next area I want us to touch on. So the women who have been participating in this project have been working in kind of small groups together, talking about their stories, but it's a lot more than that. Like you said, when you talk about the kinds of things that Black and brown women are going through their pregnancies, through their birth, it is more than just the numbers, it's more than the data, but it is something that has to be unpacked and something that has to be handled with care. So how have you seen sisterhood play a part in the way that these stories have unfolded in their groups?
That's a great question, because in these sessions, and a lot of the women are here today, we as a collective group, not, oh, because you have these purple shirts on, or you're here, or I'm here, or whatever, we all come together and we have cried, we have meditated. Am I right, my ladies that have been in? We have meditated together. We have all felt like, Alexia, yeah, she's a therapist, but she one of us. She on my team, you know? Oh yeah, when Regina got pregnant, that was a whole nother, a whole nother layer. Because we take this work so serious, we normalize, but not normalizing the situation, but sis, like, wow, that happened to you? That is not right.
You hear it, it gets to the point where you hear it so much
Yeah.
that we become desensitized.
Right. And
We don't feel the need to
Yeah.
tell each other.
Right.
Because it is something that we experience and we know that our mother experienced, our sister.
Yeah, so many times I had to take women outside in the hallway to just hug them so they could cry, because they had never told their stories before. They never felt like they were hugged, or something that someone else said, it triggered them. You know, and it was like, oh my gosh, I didn't know that this girl right here was dealing with the same thing. So they would hug each other. So the sisterhood was definitely cultivated in those groups, just because they felt seen. And there's power in storytelling. And I think a lot of them didn't recognize them telling their stories was helping someone else. But we normalized that you should tell your story as much as you want to. You want to tell it again and again, and they did. So, yeah.
And some of them were even brave enough to tell their stories and share them with us. Like I said, you will hear some stories tonight. These are real stories
Real life.
from women in this community. These are not falsehoods. My co-founder, Hannah Hassan, over there is our playwright, but she is not a fiction writer. Everything that you will hear is from direct conversations that we have had with members of the community. And so when it comes to sharing the stories, it takes a lot of bravery. So I want to, if you don't want to identify yourself, that's okay. But I do want to give a round of applause, a quick hand, for all the women who have been brave enough to come forward and share their stories. Because it is only in the sharing of the stories that we can uncover the things that are like.
If you feel led to, we have people here, they're standing, they want to be acknowledged for their story.
We thank you. Keisha, what have you seen of sisterhood in these groups, but also just in general? How have you seen sisterhood in Boston Thurman neighborhood community through challenging times, through difficulties, and in the sharing of these stories as well?
The sisterhood in the neighborhood, with Mary, you know, we can always, there's always, let me reach out to Mary because I think she'll be able to help. There's always somebody that can help, but I know I go to Mary because she's in the neighborhood. People know her. People see her. They see her when she works with us, and I automatically say, well, let me ask Mary first, and let me get back to you. But just like Alexia said, you know, in these group sessions, like, you know, they see me, a lot of times they'll see the behind the scenes because I'm sending the emails or I'm sending the text messages.
Doing it all. She be doing all the things.
But when they see me, they're like, oh, okay. Miss Keisha, I think that I might need some resources. You think you can help me for this? Or, Miss Keisha, what you doing today? And I'm like, nothing. I ain't doing nothing. Y'all can text me, you know. Of course, when I'm not doing something like this. But it's just a sisterhood of like a total of maybe 78, almost to 80 moms. And I know a great deal of them individually, one by one. So it's like the sisterhood right there, it just grew from there, from the time I started in 2023. So.
Thank you so much. Miss Mary, I'm going to ask you a little bit of a different question.
Okay.
because I'm hearing that you are part of the cornerstone of the sisterhood that's happening here.
Okay.
So I want to hear from your perspective as somebody who is a model, a leader. How is the development of sisterhood through this process, through this community? What is it like from where you sit?
Okay, that's, I was just thinking about something sort of like that. When the team first brought me on, they brought me on as a recruiter. So I was going knocking on doors to my friends and family that I already lived around. And I had a very challenging task for these moms that I was talking to. I was asking them to come share their birth story with strangers. And when we started this work, it was in the height of COVID. And we was on Zoom. And then Sherry was like, okay, they gonna put us in breakout rooms. And I was like, no. My niece is not finna share her birth story with a stranger. But I didn't realize the strength of us Black women and the strength of sisterhood. It may first started off a little rocky because we was on a computer and we was talking to strangers about, you had a baby, it ain't always pleasant. And it don't always end in pink and blue, like Alexia like to tell us. So I didn't realize the strength of us Black moms and what sisterhood really was until we had our very first in-person storytelling session. And that room got heavy, it got deep, and the way that these ladies rallied around each other and held each other and supported each other, like Alexia's saying, ripping off that Band-Aid and all that trauma just released that they had held inside for so long, and how we supported each other. I mean, it was beautiful. And then our moms involved even further. They was like, you know what, Miss Regina, we need resources out here because I know people who want to talk about other stuff outside of Forsyth County birth stories. And Miss Regina said, okay, we can make that happen. Chardonnay, she's over there. We had a fireside chat in the middle of November. It was cold. But that didn't deter the moms from coming and supporting one another, because she knew that her family and friends needed it. To talk about having a baby in the middle of COVID and your family couldn't be there to support you, your very first baby. Yeah, that's the power of sisterhood. That's what Forsyth County Birth Stories have brought to this community. And I was just lucky enough to be a part of it.
I feel like you're more than just a part of it.
Well,
I feel like you're a big part of it.
Thank you.
Yes. Oh, sure. Lauren, I'm gonna come right back. Don't worry about it.
I'm sorry, but I did have to say that we also, amongst the Forsyth County Birth Stories group, we made sure that we took care of ourselves so that we could be strong enough for the work that we were doing. We went on retreats with each other because, as Mary mentioned, that first session was heavy, and I don't think we knew what we were getting into. I mean, we knew we was dealing in some heavy territory, but it was so heavy. And Regina, she really made sure, as well as Sherry, that we took care of ourselves as staff. And I'll never forget that I was holding stuff with my own birth stories. And when we went to the Proximity Hotel, it was so, where we went in Greensboro, it don't even matter. But, I mean, it was just so, we needed that. And we took breaks so that we could fuel ourselves, so that we could be good enough to do the work and strong enough in dealing with our own stuff. So this work, although we took care of the ladies and made sure we cultivated their sisterhood, we made sure that we cultivated our own sisterhood by taking care of each other. And with good leadership, she made sure that we took care of ourselves. So I would be remiss if I didn't mention that. So thank you, Regina.
That is so important because you can't keep working. You can't keep rolling. At some point, you need to replenish yourself in order to keep the momentum going. Lauren, tell us your thoughts. What do you make of the sisterhood that you see play out as part of the story sharing in these groups and in the neighborhood?
Yeah, It's integral, as we've discovered. So I'll back up a little bit. When I was a nurse, first out of nursing school, I worked in the newborn nursery, and I learned quickly, statistically speaking, that the highest rate of survival among babies that are born premature or babies that are born with risk, by far, is African American females. African American female babies out-survive any other race or gender of baby.
We fight.
That's right. And I've heard the statistic about, or the stories about perception that Black women don't feel pain. I never ran across that in nursing school in my education, so I was fortunate because my perspective is the other direction. If I have a woman come into the clinic who's doubled over, she's hurting, because an African American female that's doubled over is hurting because they're strong. And they're not going to flinch at a migraine, right? They're going to go to work on migraine day where the rest of us are all in bed. So I think it's been, aside from something that I terribly envy, it's been really inspiring to watch the community. I shared with Alexia that when I was pondering whether or not to take the role as clinic administrator, it had been offered to me, and I laid in bed at night and thought, don't go work at this clinic if you're not what they need. When someone's angry and wants to speak to the clinic manager and you come around the corner, are you going to be what they want to see? And I really had to think about that and the trust that needed to stay in place in this neighborhood. This had been a safe place for patients. Now this is our 30th year in business. Dr. Hopkins and Maisie Woodruff founded the clinic specifically to have a safe, open, inclusive environment for Black women and brown women to come and improve their health and raise their babies and raise their families. And so being part of that and being trusted with these stories, being in a room last year in a cohort with Forsyth County Birth Stories and hearing the stories and having people open up in front of me and share things that weren't easy to say has been the honor of my career, and I really mean that. So it's something that I envy, it's something that I admire, and I think it's got more power than we probably have tapped yet. So I'm really excited to be part of anything that brings spotlight to that.
Absolutely. And to your point, Lauren, I'm just going to take a moment to say, Black women, if you have a migraine, don't go to work. Don't wait until you get doubled over in pain. The moment that you need help, seek it out. Because Lauren is fortunate that she has not been a person who has been directed to perceive Black women's pain in a different way. But we know from these stories, I know from personal experience, we can all say that a lot of other people have. So when you feel your pain, when you need help, go.
Yeah. I will add, as long as we're being transparent, this group is about transparency. When I did hear some of the stories that were shared in my cohort last year, I was, of course, embarrassed and ashamed, and also had to look at my own experiences when I gave birth, and had to ask myself, if you'd shown up at the ER with those symptoms that were just shared in that story, would you have had that experience? Mm-hmm. And it was a hard answer. Mm-hmm. And it's one of the things that drives me to get up and go into work and lead the clinic, and hopefully bring that piece back to the bigger community and the bigger organization of healthcare to say we've got gaps, mm-hmm. and facing them is not always a fun thing to do. Facing the areas where we're failing is not really fun. Mm-hmm. But if you really want to hit this data, then you've got to hear these stories, and you've got to really think about what your experience was like versus what the experience is like of some of our patients.
And you have an important job as a messenger. So your place in this work, in this community, is important. You are here firsthand, and you now have the responsibility, the task, the mantle to be the person who goes back to say, hey, we have gaps. Hey, there are things that we are missing. Hey, these women and these babies and these children are not getting the care that they need.
Yeah, and even better would be 5-10 years down the road for us, mm-hmm. to go, not just me to go to the podium. I want people to be heard. Some of the brightest, smartest, most intelligent, faithful women I've met since I've been the CA at today's. And so I don't think I need to be a speaker. I think that the women need to speak for themselves and be heard. And that's the goal, really, right? Is that you don't need to have a front man, that you're heard directly. So that's ultimately what we want to achieve.
I want you to keep the mic because I want you to answer our next question. Based on what you've seen, what you know, just off the top of your head, what do you think is the greatest challenge that Black and brown women experience in the maternal health process? The number one thing, if you had to name one thing off the top of your head.
How do I put it into a word? The historically significant or the historically founded lack of trust in the healthcare industry. The grandma saying, don't take that baby in to the doctor for this. They're going to think blankety blank, right? If I come in with this child who fell down and hurt themselves, they're going to call an agency and have my parenting questioned. You know, things like that. That just innate mistrust that has come down through generations, that's come from a very solid reason. We got some making up to do in that area. And so when when our operational flow is still very, you have to fill out this form first and you have to do this and your insurance isn't verifying, you need to call this. And when we meet people with that, when I always say we don't lead with policy when we greet our patients, but when we lead with policy of any kind in any organization, that's a little barrier, you know, like a little wall that comes up. And when you add the history of Black healthcare, right, healthcare in the Black neighborhoods, and then you're meeting people with a wall instead of a hello, what you need, what's going on, you know, how are you today, what can we do for you? It's just magnified. So we've got to kind of get up into the organizational structure, greet our patients differently, regard our patients differently, hear the stories. When I started as a triage nurse, I was trained to answer the phone, you know, blankety blank family medicine, this is Lauren, may I have your name and date of birth, please? And they literally trained me, don't let them start in on their story. You'll never get off the phone. Don't let them start their story. Just get their name and date of birth and get the data, right? Novant has turned it over a new leaf with our current leadership to where we want to hear the story. And now the training is you have to hear your patient.
Yeah, we want to hear everything from the jump.
The healthcare will take care of itself. The actual medical care is innate. That's built in. It's fine. If you're not hearing your patient, you're not providing what they need. And so I'm proud to still be with them. Do we always do that? No. Are we failing? Still, yes.
Yeah.
But I think that's where we start, is understanding the person in the story is where the healthcare lives.
Thank you for that, Lauren. Miss Mary, tell me what you think. What is the biggest barrier that you think that we're facing in this process?
Yeah, so I've actually been working in healthcare for the last 20 years myself. And I see it, I hear it. A young Black mother or patient come in for medical treatment, and they already got everything figured out. She's on Medicaid, she's a single mom, and she's aggressive. Before I can share my story, they already got my treatment plan figured out. And that's a challenge because they don't know the perceived negative narrative about me and Black women is what I see as the biggest challenge for us in healthcare.
A one-size-fits-all approach, and the size ain't good. It don't feel good.
If I would have to say, just not being heard. You can tell them, like, this is what's going on. I'm having this headache, and I've had it for 2 days, and something just ain't right. And they're like, it's okay. You all right. You're going to be all right. Just go lay down. And then later it turns out to be something way worse than you can even imagine. So I would have to say just being heard is the main thing.
The question is, what do you think is the greatest challenge that Black and brown women are facing, Black women are facing in the birthing maternal process, maternal health process?
Thank you. So, such as what Keisha said, is the lack of being heard. Also, just the stereotypes that come along that are already in their mind, healthcare providers' mind about Black women, those preconceived thoughts about us. It's just we don't feel pain. We can treat you better than you think you can. We know what's best for you. I mean, it just runs the gamut of the whole thing is you're not listening to me. You know, when I say I'm in pain, that's what I mean. That's not you telling me that, Lauren, I'm gonna use you as an example, so don't, that because
take it
I'm not
personal, Lauren.
doubled over in pain, that I'm not in pain, you know, because people's pain levels and tolerance are different, but meanwhile, my appendix is rupturing, you know what I mean? So it just runs the gamut, but basically is, the narrative is, I know what's best for me. You know, you cannot tell me that you know what's best for me. And that's where the advocacy in my role come in, is that, no, you're gonna listen to what she has to say. And if she says that her baby is down there, you need to check her and not tell her that, I think you're fine.
Yeah. So we're not being heard, we have stereotypes, we have procedural boundaries.
All that.
All that.
Yeah, you think you know what's best for me.
So I want you to answer our last question first. And I'm gonna give all of y'all 5 seconds, okay? So I'm gonna tell you the question first, and then I want you to think for 5 seconds, okay?
Yep.
The question I wanna know from you in one sentence,
Yep.
if you had a dream, in your wildest dream, what do you envision as your greatest hope for Black maternal health?
Got it. That more Black women will become doulas. More Black women will enter into healthcare. More Black women will stand up for their sisters, and that we will be heard and we will not be judged based off of what's in our pockets, because at this moment, with all the education that I have, a white woman have more privilege in the healthcare system than I do.
And she did not even need the 5 seconds. She didn't even need it. Thank you.
To piggyback off of that, I would like to see more doctors that look like me, more midwives and more doulas.
I think a lot of people don't realize how many different ways there are to be involved in the healthcare process and maternal health. Like, we're talking about doulas, midwives, nurse practitioners. There are so many opportunities. You don't have to just be a doctor to be able to be present and be part of the process.
I became a doula doing this.
Mm.
So, yeah.
She need a mic again. So
What's
the
your
question
greatest hope?
Okay, my greatest hope, my greatest dream, I would have to say it would be something more of a personal matter than trying to change a healthcare system or these agencies or institutions. My greatest dream would be, as a Black woman, that I can just show up in any space, in any place, and just be Black. And just not... Thank you. I mean, so many times we overcompensate to try to make Lauren feel comfortable to come into the...
Laura, are you gonna make it down there?
I mean, it's just so many times we have to bend and just forget. I mean, it's frustrating, but it's so exhausting. Like, sometimes I just want us to just be able to exhale. Like, can I just be Black?
And that has an impact on your health. Your ability to be yourself, to show up as yourself, has an impact on your physical, your mental, and your emotional health.
Exactly.
As long as we're asking, I'd like to be Black too.
Well, I don't know if that's something we can do.
I know.
But maybe we can help you achieve your wildest dreams for Black maternal health. So what would that be?
Actually, it's a combination of both. I agree that we need more Black healthcare workers. When I hired my new providers for my pediatric clinic, we lost both of our African American providers a couple years ago. I had read on the surveys, I like coming to a clinic where people look like me. I knew it was a very important piece of what we do for the community. I had no applicants for any nurse practitioners, PAs, or MDs that were African American. And I had to staff the clinic. And I had some really great applicants that were Caucasian. And I hired them, and they've been fantastic, and the neighborhood loves them and trusts them. But it's unnerving to me for me to come in and a year later hire 2 white, pediatric providers and not look like we're whitewashing the clinic. I mean, those are the kinds of things that I have to think about all the time if I want the community to continue to trust us, right? So we need providers. We need people that want to come serve their own communities, and we need to empower people to feel like, I'm telling my nurses, you need to be professional because the little girls that are coming into the clinic are looking to you, and they may want to wear scrubs someday and be in the healthcare industry someday, and you need to be that example, right? So I agree with that. I also agree that the women that do succeed in the healthcare industry that are of color, that are African American or black and brown, sometimes have to put on a face. And I would just like to see some authentically, some people that want to stick with their roots and be who they are. You don't have to dress a certain way or be a certain way or speak a certain way to be successful, brilliant, and effective. So I like both. I'd like to see people work in healthcare, and I'd like to see them be themselves in healthcare instead of having to be, a paled down version of who they really are.
Yeah, we do
That's what the
too. We
patients
want that.
And that's who you want to go to for your healthcare, right? Is someone who gets you. When I started at Today's, I've been taught as a supervisor that we always greet our patients with, good morning, my name's Lauren, I'll be your, blah, blah, blah today, I'm here to help you, how can I help you? Our patients don't want to be greeted like that. They've known Margaret for 20 years. She's worked in that clinic for 20 years. She's not going to greet the patients with, good morning, I'm Margaret, I'm here to, the patients are going to be like, what has happened in here? So I had to learn as a clinic administrator, I had to throw some of those rules a little bit to the side and greet the patients like you would greet them. Just greet them. We're in the neighborhood, just say hi, just know them and say hi to them. And so sometimes that doesn't sound like Novant would like it to sound, but it's okay. It's how the neighborhood needs us to be. So
yeah, you gotta, Lauren, you gotta tell a friend to tell a friend. We have to be in community in the ways that people are in the community.
that's right.
All right, folks, please give a round of applause for our panelists. We thank you so much for sharing time and space and all your intellect and thoughts with us. And now we're
for the very first time. Oh, the melody that pulls you towards it, painting pictures of paradise, singing, rise up till the light and the sky, watch the light lift you.